So I'm Nurse Maria, Nurse Joseph, a menopause and women's health nurse. And for years, I've been helping women just like yourself and myself cut through this confusion to help balance our hormones naturally and finally feel more in control of ourselves again. So in tonight's episode of the Healthy Reset, we are exploring what really happens to our hormones, to our emotions, and to our bodies after a hysterectomy. So you'll learn whether removing your uterus automatically triggers menopause, what happens when your ovaries are taken out, how to navigate the emotional, physical, and hormonal roller coaster that sometimes follows surgery, and the best way or ways to reclaim your balance naturally, medically, and holistically. So if you or someone you love has had or is preparing for a hysterectomy, this is your space. So let's grab a cup of tea, get comfy, and let's reset together. So let's start with the fundamentals, because not all hysterectomies are the same. So it's important to know that. So what is a hysterectomy? A hysterectomy means removing the uterus, but depending on what's taken out, the effect on our hormones can vary, meaning it can differ. So let's look at these examples for types of hysterectomies. Let's look at partial hysterectomy. A partial hysterectomy means only the uterus or the womb is removed, but your ovaries remain. The total hysterectomy means that the uterus and the cervix are both removed. And then there's a total hysterectomy with bilateral oophorectomy. That is the uterus, the cervix, and both ovaries are removed. So why does that matter so much? Because your ovaries are your hormone factory, and they produce the estrogen, progesterone, even a little testosterone. So if your ovaries are removed, your body experiences an immediate and dramatic drop in hormones, what we call a surgical menopause. So if your ovaries are left in, meaning if they are left and they weren't taken out, your body continues to produce hormones and you'll go through menopause naturally. That is later on when your hormone levels naturally slow down. So ovaries equals hormone control center. So hormone levels dropping sharply happens when the ovaries are removed. So I want us to think of your ovaries like tiny thermostats, which you know what thermostats do? They regulate heat, and in our case, they regulate mood, and they also regulate the rhythm of our bodies. So when they are suddenly gone, the system goes into what we call a shock before finding its new normal. So in this segment, we'll look at natural versus surgical menopause. So here's where a lot of confusion happens. The difference between natural menopause and surgical menopause. Now, in natural menopause, your estrogen and progesterone decline gradually, usually between the ages of 45 to 55. And give and take, for many women, for some women, it may be earlier than 45. Some women as early, I've met some women as early as young as in their early 30s. I've met a few about 32 years, and I've met older women in their 60s, and going through that aspect of their period, they're stopping their period. So those are what I call outliers, but generally speaking, it's between 45 to 55. So actually, it means that you're going through it at a slower pace. It's slow and tapered, and your body adjusts to this change over time. But even though it may be slow, many times for women like myself and many of you all as well, it can still be a roller coaster. So just think about someone who has had it done surgically, and let's look at that now. But surgical menopause is it's instant. So one day you're producing hormones, and then the next day you are not. So this is what happens. And that sudden shift can bring symptoms that are more intense, like hot flashes, that intense feeling of heat, and then flushing of your face may get pink, it gets flushed, and then you have hot flashes, which are night sweats, which are hot flashes that occur in the night, and your clothes drenched down with sweat and things like that. So, and you can't sleep. That suddenly hot, uncomfortable feeling accompanied by sweats. That is the night sweats, because that are hot flashes in the night. Then you have the mood swings. You're just being angry, upset just about everything. Somebody might be complimenting you, and you're getting angry just like that. And then that brain fog, that makes you just forget, you go in a room and you didn't know what you went in the room for. You have to go back out and then go back into recheck and reset your mind as to what I really went in this place for. What am I doing in this room? So, and then we have as well low energy, that draggy kind of tired feeling that no matter what you do, you're tired, and that low sex drive. And with that low libido, many ladies, I would like to tell you too, you have a partner, let them know what you are going through. Try not to keep that to yourself. My advice is, let your partner know how you feel, because in many cases, the men, just as you may be going through your turbulence, they may feel like you don't want them. So you have to let them know what you're going through, and let them experience, tell them about it, because many times they are concerned and they do not know how to help you and they want to help. So let them know that sex drive, that feeling that you don't want sex again, you're not interested, that loss of libido can really affect a relationship. So let them know, let them in. So let's meet Claire. Claire is 47. She had a hysterectomy to treat fibroids. She expected to feel better, but within a week, she was waking up drenched in sweat, anxious, and crying without a reason. Why do you think that happened, ladies? Her ovaries was removed, right? And she entered surgical menopause. And that seemed to happen overnight. So Claire's story is very common. And it's why understanding your specific surgery and preparing for what comes next is very important. And it's the most empowering thing you can do for yourself. So in this segment, what happens to your body? So let's go a little deeper into what's happening inside your body now. So when estrogen drops suddenly, you might experience, and as I always tell ladies, we may not get it the same way, but we get some people get a whole lot of the symptoms, some get minimal amounts of the symptoms, but we get a lot of the symptoms in between. It varies, not one cap fits all. So we may experience the hot flashes, the night sweats, the vaginal dryness, or the discomfort. So your skin gets dry, you feel itchy as well on the skin there, and sometimes vaginally, that itching because of that dryness down there. You get suddenly getting joint stiffness as well. We know why too, because inflammation increases, cortisol increases, and that causes inflammation as well to increase at this time as well. And what about hair thinning? Many of us, any of us, we experience hair thinning. You can put up a raise of your hand, and skin changes. You may see wrinkles in places that in your face that you never saw wrinkles before. Yes, static. Yes, Denise. Yes. So the hair thinning, Natalie. Yeah, I'm seeing Natalie. Sorry, Natalie said here, and I'm having that problem as well. The hair thinning, the skin changes, not that bad with me, but the hair thinning is where I'm getting a lot of my issues. So many times you would see that sometimes I might have my hair short. It starts to grow, it drops very easily. Sometimes it grows very quickly, and then it drops easily, Natalie, as well. So with me, actually, it doesn't matter. I try a lot of hairstyles. Sometimes I want hair, sometimes I don't, sometimes I cut the hair. And I just try to work with my body according to how my hair may be growing or dropping, right? So yes, I go through a lot of the hair thinning as well. Low progesterone also adds poor sleep and anxiety as well. So those of us who are suffering from poor sleep and that anxiety, it is because of low progesterone. And when testosterone, and yes, we have much lower doses of testosterone than the male, but we do have testosterone. When testosterone falls, you might notice that fatigue and that loss of drive. So estrogen protects bones, it protects brain and mood. Estrogen is what we call the protective hormone. It helps your bones stay strong, it helps your brain stay sharp, and it helps your mood, help you with a nice, good mood. So after hysterectomy, you'll want to pay special attention to bone density, muscle strength, and heart or cardiovascular care. So have any of you noticed any of these symptoms? If any of you had surgery, any of these, you can show by the raise of your hand. And if any of us have had, yes, Candice, very good, thank you. Which one you had, Candice? So I want to leave you we could talk about it a little later on as we continue. Anyone who is willing to talk about the experience that may help. Anxiety. Candice said she had anxiety after her surgery, right? So any of you willing, after we are finished, you can share something that may help somebody else prepare or understand what they too may be going through during this time if they have had a hysterectomy. So now let's talk about something less visible. Let's talk about our emotional recovery. Now, for many women, hysterectomy brings relief. You're happy. All these problems I had with this bleeding and this fibroids and whatever other issues you had with during this time. And no more heavy bleeding, no more chronic pain. But it also brings sadness and grief. You might think, well, why do I feel emotional? The surgery fixed my problem. But remember, your uterus, especially if you did you removed your ovaries as well. Your uterus and ovaries are not just physical organs. They've been part of your identity for decades. So losing them, especially suddenly, you can feel like you're losing part of yourself. So it's okay to grieve. It's okay to have or feel mixed emotion. It's okay if sometimes you feel gratitude and sadness at the same time. Sometimes these things go together. So the hormonal shift can amplify your mood swings. It can amplify your anxiety because estrogen influences your body feel good. It's your feel good hormone, right? So it influences these things. So please, what I'm saying to you ladies, do not suffer and do not suffer in silence. Talk with someone, talk to your doctor, talk to your a sexual health nurse like myself, talk to a counselor, join a support group. Those of you who are not on one like I am, like we have here now. This is our space to talk, to let for you can learn from other people and know that you are not alone in this journey. So share what you're feeling with loved ones. This is a part of our healing journey. It's not a sign of weakness. I just want us to understand. So remember, I've been speaking about journaling, right? Journaling. Anybody started to write down any of their feelings yet? And the importance of journaling? All right, journaling is important and it works for me because it allows me to express myself in ways that I cannot say verbally. So I like journaling and it's not the same for everybody. Some people like walking in nature. Some people like to do what we are doing today, like attending support groups, and not just my own alone, but other support groups to learn what they could learn. And it is a very healing thing. Some people, meet with friends, go out. Healing after hysterectomy is not just physical, it's emotional reintegration. That's what I call it. So what are some of the treatment and support options we have at this time? Now that we understand what's happening, let's talk about what you can do about it. So option number one, there's hormone replacement therapy. And this one is not for, as I said, one cap does not fit all. So this is not for everyone, particularly if you had a hysterectomy due to having cancer. So hormone replacement therapy is not the first choice recommended because it's one of the side effects is possible certain type of cancers, breast cancer, especially if you may have be more prevalent in your family tree, or if you've had cancer and that was the purpose you had the hysterectomy, hormone replacement therapy may not be for you, but it may be an option for someone else. So if your ovaries are removed, your doctor may recommend hormone replacement therapy to replace those lost hormones. It can significantly reduce the hot flashes, protect your bones, and help with mood and energy swings. There are what they call patches, gels, and tablets that your healthcare provider can help you with some of the symptoms. Consulting with your doctor here plays a very vital role. And then there's the non-hormonal and lifestyle support. If HRT, which is hormone replacement therapy, isn't an option for you, there's still so much you can do. Let's look at nutrition, adding phyto, estrogen, rich foods like flaxseed, soy, lentils, chickpeas, otherwise known as chana, to us in this part of the world here. So eat plenty as well as colorful veggies, calcium-rich foods, and healthy fats, as well as staying hydrated. So keep your fluid levels up and stay hydrated. I say many times, I try to eat a lot of water-rich fruits like watermelon, which is one of my top choices. I use coconut water, nice, because we are 75% plus water. So our body is water-based. We were in our mother's womb in water. We are also water supposed to be a very, very important part of our change. As we go through this change, it keeps our skin moist. It helps, help with that dryness. So hydrating is very important at this time. And what about movement? Movement for those of us who want something natural and to help go through this transition, movement is important. It's important here to prioritize strength training, not just walking alone, but strength training at least two to 3 times for the week. And also weight bearing exercises is very important because we know that we lose muscles, bone at this time, bones, and so this strength training and weight bearing exercise is very helpful to us at this time, strengthening your bones to protect you from breaking your bones when you get in fall due to osteoporosis. And let's look at stress and sleep as well. How can stress, sleep help with stress at this time? Creating a bedtime ritual is very important here. Dimming your lights, no screen time close to bedtime, ladies. Have a nice cooling fan or your air conditioner, you put it at a nice cooling temperature for night sweats. Light garments to sleep with, very light. And also practicing relaxational techniques like deep breathing. Some of us we use prayer. Some people like to use yoga, and these different things can really help us at this time. And what about supplementing? I always talk about the importance of supplementing. I don't want us to forget how important that is. So talk with your doctor, of course, especially if you are taking you are on medication, but some women benefit from, like I do, from the magnesium glycinate, from the D3, the K2, from probiotics, which is one of my go-tos to help with bloating and keeping me regular and stuff like that. The omega-3 as well, which protects heart, which guards the heart health. So these are some of the supplements we can use along with eating healthy. And then there's also a community. Joining a community like this with supportive networks like ours here online, and talking helps more than you think, ladies. When you talk, it really helps to release a lot of the pent-up feelings that we have. So there's no one size that fits all because we are all different. We don't get the symptoms the same way, right? We don't have the same health issues. So there is something for everyone. May not be in the same proportion or the same way like someone else, but there is something for you. So what matters most is your comfort, your values, and your health goals at this time. So you have the right, at this time, you have the right to feel well and to make informed choices for yourself at this time. So let's look at some real women, real stories. Let's listen to a few women at this time. One who used hormone replacement therapy. One who used lifestyle changes, and one who talks about emotional recovery. right? Anybody like that? And you have and those women I'm talking about is you ladies. Anybody here who tried hormone replacement therapy? Or anybody at all who use lifestyle changes? I'll start with myself. I can tell you, as for me, even though I didn't have a hysterectomy, I have been one who used lifestyle changes for my symptoms. And as I said before, my go-to is exercise. My go-to is magnesium glycinate because I have real bad cramps. It sometimes wake me up from sleep. So sometimes I say to myself, I take this magnesium on a regular basis. I can stop taking it probably for a little week or so. And when I do, my cramps come, they come aggressively, ladies. So I can tell you for me that lifestyle, yes, magnesium glycinate after surgery, yes. Yes, Mish. Because one of the things it does, it helps you to relax, it helps you to sleep, it helps with the cramping. And at this stage in our life, we do not produce that amount of magnesium as we used to. And hence the reason why many of us have that night cramping, right? I have that a lot, right? And if I don't use my magnesium glycinate, I will be in a very, what they call a hot mess, right? That pain wakes me up. It's either my daughter rubbing my leg and I'm crawling, they're not pulling my foot enough, they're not massaging it good enough. It's horrible. So I try to keep that magnesium glycinate with me, use that as regular as possible. So lifestyle is my go-to. If your uterus is removed, do you still go through menopause? I want you all to put in the answer box. You can put in a yes, no, maybe. What do you think? If your uterus is removed, do you still have to go through, or do you still go through menopause? Take a moment and think about it and drop your answer in the comments before watching the rest of our episode. So ladies, again, I want to thank you for the time and your effort for coming out here. It is very encouraging. And I would like, Keisha, you have a question? I seen a hand up by, no, that was my, sorry, that was my sister. Sorry about that. So I just want to wish everybody a good night. And I want to thank you all for coming again. And we would have a few speakers on within the next few weeks coming up, not just yet, but we're getting speakers to come on and say a question, speak with you, and, on different topics that we have coming up. So thanks again for having us in your homes and in your hearts. And have a good week.
Okay, have a good night. You want
Good
to
night. Thanks a lot.